I think for mothers with infants with congenital heart defects, there's a lot of emotions involved, worrying about your child and whether or not they're healthy and they're going to be okay. And feeding is really the only thing that this mom might feel like she can do for her baby. And often when that experience of being able to breastfeed their child is not an option, I think these moms really struggle with the anxiety and the unknown of what that pathway might look like.
Once the baby is brought to our unit, we check in with mom pretty quickly and kind of see what her plans are and if she's wanting to breastfeed and if the baby's able to or not. And we can be there for a feeding to actually see them put the baby to breast and help facilitate holding the baby and giving them to mom and helping with positioning, because that can be very unnerving, especially when they have a lot of cords and cables.
When infants are born with congenital heart defects, often they're not able to stay with their mother right after birth. They might have to be taken to the NICU or the cardiac unit immediately after they're born. In a cardiac unit, we focus a lot on making sure babies get optimal nutrition. I think mothers get worried that they're not going to produce enough, and there's a perception of being concerned about low milk supply. Here at Lurie Children's Hospital, we have a lot of options to support breastfeeding with our nurses and our lactation consultants and speech pathologists as well to answer questions.
At times, babies with congenital heart defects do need more calories to continue to grow since their heart is sometimes working a little bit harder than a normal baby heart. There are a couple ways to supplement. You can supplement with formula, or there are fortifiers for breast milk that you can feed the baby through a bottle, so they are getting enough calories that they need to gain weight.
It's most important for your baby to have good nutrition so that they can grow and develop into the person they're supposed to be. I strive to support moms with any breastfeeding goal that they set, whether that be exclusive pumping or getting baby to breast to be a successful breastfeeder. It's a process, and it's something we continue to analyze and work on throughout the experience of your child's hospitalization.